and also to help them fade away a little bit more naturally than they would have gone away on their own.
Can you talk a bit more about how much it costs and what kind of help might be available that you know of for people outside of the US to maybe get surgery?
Right. We have 3 different levels of costs. If it's a very, very thin guy, that's obviously going to be the cheapest because it's less work that I have to do. A thinner guy can take about an hour and a half, hour and 50 minutes. So it's less time in the operating room, so it's a cheaper cost, and that averages about, I would say, $7,000 US dollars. A medium-sized guy is going to be about $7,600, and a very heavy guy is going to be about $8,300. American dollars. And I don't believe there are any outside of the U.S. insurance plans that I take. I certainly don't take your National Health Service insurance. But the fortunate thing for us in the United States is that more and more insurance companies are covering it. So a lot of the major players like United Healthcare, Cigna, Aetna, Humana, Medicare, which is our national health service, will cover it. But even then, only a portion of the procedure is covered by insurance because part of the procedure is considered cosmetic by the insurance companies. All the additional liposuctioning that we have to do and the excess skin contouring that we have to do is considered cosmetic. So until our health service comes up with what's called a CPT code, a current procedural terminology code for top surgery that encompasses all of those things, the best that we can do is bill the insurance company for a bilateral simple mastectomy, and sometimes they'll cover nipple reconstruction depending. But a lot of those things aren't covered by insurance, so we have a cosmetic surgery fee as well in addition to the insurance fee.
Did you say that you said something about bottom surgery?
I don't do any bottom surgery. But in the male to female patients, I will do some facial feminization procedures like facelifts and eyelids and the tracheal shaves. But I don't do any major bony contouring, like taking down the bony contours of the skull, or I don't do much rhinoplasty surgery anymore. And I don't do any shaving of the angle of the jaw. But a lot of the other facial feminization procedures I will do. Fat grafting. I will do liposuction, body contouring, fat grafting to the buttock, those types of things. And body masculinization, certainly, liposuctioning and those types of things.
But like anybody coming into our clinic, if it's somebody who wants to look prettier, we can make them prettier. If it's somebody that wants to look more handsome, we can make them look more handsome. It doesn't matter what gender they are.
Well, it's all about individualizing the procedure, and just as I was saying before, this even top surgery is not a cookie cutter operation. You can't do the same operation on everybody. Everybody's body is different, and that's why I like to get patient input about what they like and what they don't like, so that we can try to individualize the procedure as much as possible. And same thing goes for facial procedures. You have to listen to the patient. What are their desires? What are they trying to achieve? And then our job as a plastic surgeon is to try to let them know what the options are to try to achieve those end results.
Can we cover again post-operative care, how long people are with you and what you do?
Most people that come from outside the U.S. are in Florida for about a week to 10 days. So they'll fly in usually the day before surgery or 2 days before surgery to acclimate a little bit. They come in the day before their surgery for a preoperative visit. At the preoperative visit, we go over the consent forms, we take preoperative pictures, we answer any other questions that the patients might have. We educate them about what their preoperative and postoperative experience is going to be. Then they'll come in the morning of surgery for their procedure. And the surgery typically takes about an hour and a half to 3.5 hours, depending on the size of the guy. And then they're in the recovery room for about an hour and a half or 2 hours. And then they go back to New Beginnings Retreat. They'll come and pick you up and take you back to the retreat. Or if you're staying at a hotel room, you go back with one of your family members to stay at the hotel. And then I see you back the day after surgery to make sure everything looks okay, make sure that the dressings are nice and dry, making sure that the drains are draining properly, making sure that your pain level is under control. And then I see you back a week after surgery, which is typically 6 to 7 days after surgery, to take off all the dressings, take out the drains, go over the dressing changes to the nipple areola, and then teach you how to do the dressing changes, and then teach you how to wrap your chest. And you'll do that night and day for the first 4 weeks after surgery, and then after that, no more binding or wrapping.
So a total of how many days then?
So typically between 8 and 10 days here in the United States.
In terms of revision, though, that would probably be less.
A revision is typically less, yeah, because you typically don't have drains. So
Yeah.
the main reason people are staying locally is because of the drains, and also for the nipple grafts.
Okay, I think we're just about done there. So thank you very much. We might add some more on the end if you have
Okay,
any more questions
yeah,
that we
sure.
want to film, but thank you.
Thank you very much.